Hi, I'm Dr. David Warwick of Warwick Chiropractic in Lacey, Olympia, Washington, and today this is tip number 7. Maybe you just need a lift. A lot of times when you have back pain, low back pain especially, or even SI pain, or nerve or traveling pain that's going down the legs or in front of the legs, many times the chiropractors can correct that, and when we correct that through the spinal adjustment, that helps get that pressure off there. But many times that patient, or sometimes I should say, that patient doesn't hold their adjustment as well. And we need to look at a couple other things. And I want to talk to you about a leg deficiency or a shorter leg on the side. And you may hear us talk about a short leg, especially in my videos. Really important thing here is that sometimes the actual leg needs a little bit of a lift or support underneath that, and there's 3 ways that we can look at it. And the first way that a chiropractor, or including myself, I'll actually speak for myself, is that I look at the short leg and I see how through the adjustment it can change the leg length by realigning the spine, realigning the pelvis, which inadvertently affects the length or the pulling of the muscles, the tension on the muscles pulling up. We call that a pelvic deficient side. So you can adjust one or the other side on an individual. I like to see, and we'll see the most changes when it's 10 millimeters or less, when that actual adjustment is holding in there. The second thing to look at is, so the first was a neurological. The second is anatomical, born with a shorter leg. When you're born with a shorter leg in there, there's a deciding factor that I make that if it's 10 millimeters or more, then I start looking at a lift. So I start out real conservative in making the spinal adjustments to the spine and seeing how the body's adapting and changing to that. Then I look to see if it's congenital. And the way you can do that is a couple things. By when I take an x-ray or order an x-ray, I can look and see the height of the femoral heads of the femur that are inside the pelvic area and see how much difference there is one versus the other. And this is a film that's taken in a standing position. And third and last thing is a combination of both. So when you get a lift, this is what they kind of look like. The actual lift is fit to that individual, and you can determine it one by imaging or x-ray, and the second way to determine this is actually with muscle testing the strength of the body, so you could go various amounts of millimeters to make change. I typically don't like to make change. I will make a correction between 50 and 100% of the correction after it's 10 millimeters or more, and I wait and see how over time the various heights of the lifts can make the changes to stabilize the leg, the hips, the knees, the pelvis, or the joints all the way up to the top. So sometimes it's something over time, and you have to allow, like this one in particular is 12 millimeters. That's a really big change in there. And when you have your foot at a certain angle, you have to be careful not to be tipping the foot too far forward so the person's actually walking on their foot. So a lot of things to consider, but that is one of the things that I take into consideration to help patients with neck or with back pain, well, even neck pain, their posture, as well as SI pain or even pain down the legs at all. So I'm Dr. David Warwick. I hope that you enjoyed tip number 7. Maybe it's just as simple as needing a lift after working with me for a while. If you need some help with that, give our office a call, 360-951-4504, or go online to my website at drdavidwarwick.com. Thank you for watching, and I'll see you soon. We'll be coming out with tip number 8.